Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Cranin-Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
We are also, as a reminder, going to be in Upstate New York in July. So if you are in the area, if you can travel and come to us, I think it would be absolutely amazing. It's at the Omega Institute. It's a beautiful ground. I spoke to someone who lives actually not too far from there, and he said it's absolutely stunning. The food is amazing. It's a really, really great place to have different retreats and events and things like that. So it'll be fantastic to be able to talk to Melinda, Cam, and Paul all in person, and kind of get a crash course and get that in-person feel also. And we just want to meet people too. It's great to see you guys actually in person.
Yeah,
it's like a good retreat.
Yeah, it's a 3-day retreat too. So it's Friday. It starts Friday, I think, around 5:00 or something.
Yeah.
And it's all day Saturday and Sunday till about noon, I think.
11 or 12.
Yeah. So it's like a crash course in the concussion fix, but we're going to answer lots of questions. We're obviously going to be there in person. So, we find it just so much more valuable to even, these are great sessions, but in person it's even better. Yeah. Come see us.
Yeah, it's going to give us a chance to do some experiential work too. It's hard to explain a lot of the modules that I do because it is so experiential. So it'll be so wonderful to be able to do some practices together and try things out.
It'll be absolutely amazing though. So hopefully we can see a whole bunch of you there. The other thing, I want to give a shout out to a couple of our members this week who have done absolutely amazing. Was able to decrease his symptoms by 79 points in 6 months, which is absolutely amazing. And went from 77 out of 132 down to 9 in only 3 months.
Yeah.
So very exciting for both of those members. So we can head over to the questions and start with.
I just wanted to ask if you guys could help explain what's going on with me. I feel quite crappy today, but I will try to explain. I had somatic experience therapy yesterday, and we worked through a fall I had like 20 years ago, where I fell backwards and I injured my neck and my head. And my body kept wanting to do this movement where I moved my head backwards like I was falling. And it did it really fast. So we played through this incident very, very slowly. And like instead of what happened 20 years ago when I knocked my head down into the ground, I would support it with my hand and then I would land in a soft pillow. So I think we kind of released a lot of the tension. Afterwards, I felt like I felt really tired, but in a relaxed way, and like my body just relaxed. And now afterwards, I just feel very, very tired, and I have a lot of nausea and dizziness, and I'm just, I don't know. I think I just need you guys to explain what's going on. The back of my neck feels softer than usual. Normally it's more tense, so I guess that's a good sign. If I just even touch my SCM muscles, I get super dizzy. And I've been sleeping a lot and lying in bed a lot since yesterday, and when I'm up, I have to like walk slower because I feel dizzy and I just feel off. Yeah, so I'm just wondering what's going on here.
Yeah, I mean, I can start, guys, and then we can kind of give you a three-pronged approach here. But with somatic experiencing, and of course, every provider practices differently. But with somatic experiencing, we're sort of, from what you're sharing with me, it sounds like their approach was to redo the movement that was traumatizing with your initial fall in order to help you sort of reprogram the body's response, sort of rebuilding safety, if you will. That's sort of what I'm hearing. Does that sound accurate to you?
Yes, exactly. Yes,
Okay.
that's what she
And
does.
but how many times did you go through that movement together?
Well, at first, the fast movement, my body kept wanting to do it, if that makes sense, like really fast.
Okay.
So that happened a lot, and that's why we went into the slow movement where she wanted to, make it positive. And that one we did once, and we weren't sure afterwards if we were done or not. So she explained to me how to do it at home if I kept having a sensation of falling backwards. But I feel kind of insecure about doing it at home because,
You've had a reaction to it.
yeah, and because I feel more secure when she's there and she's guiding me. So I know that I'm doing it right. So I haven't done it at home. And I don't know if it's done or not. But it's this sensation of falling backwards. It's one that comes up a lot. I've been doing this for a year and a half, and this sensation comes up, but it was the first time that this specific incident came up. And now, since yesterday, I don't have that sensation unless I'm thinking about it to see if it's there. If I do that, then it comes up, but otherwise, it's more like I just feel really, really heavy. When I lie down on my side, it's like I feel like a big rock.
Yeah. So from my perspective, right, when we are purposely revisiting a traumatic experience, it makes sense to be extremely fatigued afterwards and need a lot more rest. It sounds like you really explored it in detail, and that can definitely bring up a lot of emotional symptoms, physical symptoms when you're sort of repeating a more traumatizing or triggering movement, which I'm hearing was the origin and what had happened with your initial concussion. So it makes sense to have a lot of fatigue, and it makes sense if you feel tearful or heavy. All of these things make a lot of sense. So from that perspective, give it some time. The only thing I'm thinking is, maybe it was just too quick. Maybe you did too many of the movements, or maybe, sometimes we need a more graded approach where we need to think about doing it first. Then we do it, once with some support, and, multiple times maybe comes later after like 3 to 5 sessions. And that might sort of help you build up that sense of safety in the body and knowing that you're safe. So the nervous system, even though you're in safe hands, the nervous system is going to have a response to a previously traumatic events. So that is emotional, cognitive, physical, spiritual. It's all realms. So it's not always one specific thing you can expect, but what you're describing to us shares with me that you're having a response to revisiting this traumatic movement that happened to you with your concussion, and potentially there's from Dr. Cam's perspective, maybe just that movement of the neck is sort of also causing some disruption. So I might turn it over to him and see if there's any comments there.
Yeah, I was going to say two things about that. One is, if you have issues, especially in the SEM holds your head up, right? So as you're going backwards, you're engaging those muscles to keep your head stable. So if you already have pre-existing SEM, you're going to be working those a little bit more, and it makes sense that they're going to be really tight and sore the next day, right? It's almost like you did a bit of a workout on them. Right? Like if you were going back, you're engaging your neck so that your head doesn't just flop backwards, right? You're gonna naturally stiffen that up. So there could be some elements just of neck, and you may be dealing with that kind of feeling off because those SCMs are so involved in vision and your balance and proprioceptive input that when they're really tight or activated from doing work, they're gonna feel tighter, but they're also potentially going to impact how your eyes move and how you feel just in terms of where you are in space. The next piece is that a stressful situation, like what Melinda's talking about, is that you're reliving trauma, and that's going to be inherently stressful, right? Just as you go through that, you're thinking about it, you're reliving it, you're also doing the action. And a lot of people tend to hold tension in their necks. When they get stressed, we tend to kind of lift our shoulders up and we increase the tension there. So it could kind of be twofold. One, you engage the neck probably quite a bit as you did this repeatedly. And so it could be some of that. And then also two, the stress of that situation is going to kind of engage the neck as well and increase tension in the neck. So I agree with Melinda. I think you just give it time. I wouldn't look at this as any type of real negative thing. I think it's good to kind of go down this path. But there just may be a little bit of pain along the way as you learn to engage your neck better, as you kind of reduce the stress around reliving that trauma as you continue to do it. And I think that it'll probably be helpful in the end, but sometimes you get a little bit worse before you get better. So I wouldn't worry too much about it.
Okay, thank you guys.
You're welcome. Okay, next up is...
Hi there. So how do I know if I'm overdoing it during my rehabilitation? Especially when symptoms are subtle or even delayed, or they show up the next day. I'm working towards light sparring. I'm a kickboxer, and I'm planning on doing it in, hopefully August. And I want to push just where I need to be. I don't want to keep overdoing it, if that makes sense.
Do you mean with daily activity, or do you mean with exercise? Like what?
Yeah, in terms of my rehabilitation. My daily activity, a little bit, but more so with the rehab. Being an athlete, I have a tendency of overdoing things.
Yeah, many in this program do. So what type of rehab are you referring to? Is this exercise-based rehab or like vestibular visual? Because it's different.
Right now, so recently I was doing neck every day because I found out that was a big point for me. I hadn't done it the 5 years I've had PCS, and that's when things started moving forward. But I was doing it every day, and I was advised by my physical therapist to split it up, where I do neck every other day and then vestibular. And I noticed, for example, now I've started going on walks. At about 26 minutes, then I get mild symptoms. My vision start going out. So it was just more if I should trigger that, if I should try to stay just within where I don't trigger it. Yeah.
So like I said, it's different for different things, right? If you're getting symptom flares with like neck exercise, for example, usually that's okay. It depends on how much you're flaring it. So that with that type of stuff, you want to stay within kind of a 2 to 3 point increase, right? As long as your symptoms are increasing, but they're mild, that's okay. You don't want to get to a point where you're flaring yourself up to a 5 or 6 point increase from your starting point, right? So And generally, we get people to look at everything on a 0 to 10 scale. So before you do anything, take a look at your overall symptoms. How do I feel? 0 is I feel perfectly normal. I don't have any symptoms at all. 10 is this is the worst I ever have felt, right? So where are you at right now before you start? Okay, let's say I'm at a 3, right? I have some symptoms, not too bad. When I start doing my particular exercises, I want to make sure that I stop if my symptoms hit a 5, right? I've had a 2-point increase. Okay, that's enough for today. I'm going to stop. Or that's enough for now. I'm going to let things calm down a bit before I do my next remaining kind of sets. The other thing with neck to consider is that if the rehab exercises are flaring you up, it could mean that there's dysfunction in the neck that requires more manual therapy, right? I don't recommend starting any type of rehab type exercises on the neck unless you've had really good manual therapy to kind of clean up all the dysfunction so that you're moving properly, the muscles are engaging properly, you're doing the exercises properly. Because if you have neck dysfunction, you're trying to do strengthening exercises, that neck dysfunction is going to alter how you perform those exercises, and it's not going to be the right way. So I want to make sure that you've actually done the manual therapy side first. If those neck exercises just continue to flare you up, it means there's probably some dysfunction there that hasn't been properly addressed through the manual therapy side. Okay, so that's neck. When it comes to vestibular, the point actually is to increase your symptoms. You want to increase your symptoms. And I'll point to a perfect example of this. There was a study that was done, and it was a randomized control trial, where half the group was given a particular protocol and the other half was given a different protocol. The protocols were actually the same. The only difference was the experimental group was told to push into symptoms. So when you start feeling symptoms, you keep going until they have that 3-point increase, right? So if you started at a 3 before you did it, even if you had a mild, let's say your symptoms jump to a 4, keep going. Your symptoms jump to a 5, keep going. Your symptoms jump to a 6, now it's time to stop, okay? The other group, which was the control group, they were told to stop the exercise the moment their symptoms increased. So if you started at a 3, as soon as your symptoms hit a 4, that was it, you're done. So you wanted no symptom increase with that. And guess what happened? The group that pushed into symptoms to a 3 out of like a 3-point increase, they got better. The group that stopped immediately as soon as symptoms started, they didn't get better. So with vestibular, you actually want to challenge the system every time you do it. You want to be triggering symptoms, right? That 3-point increase in symptoms. And then that's when you stop. Because over time, that's how you kind of push the line. All right. So with vestibular, you do want to push into symptoms moderately, we'll say. Because if you stop too early, you're not going to get the therapeutic benefit. All right. So that's vestibular. Exercise, you want to stay below symptom threshold. So with exercise, you want to find out what your threshold is. The threshold is having a 3 or more point increase in symptoms. And this isn't based on time. This is based on intensity. So you're noticing that at 26 minutes, you're hitting, you're having some slight increase in whatever. I don't care about the time. I care about the intensity. What's your heart rate when that starts to happen? Because if you have neck dysfunction, it could just be the repeated up and down bouncing. After 26 minutes, it starts to cause symptoms. That's not the same thing, right? This is where it comes to isolating variables. This is why everything should be done in a systematic, ordered way, right? Have we addressed the foundation properly? Have we addressed inflammation? Have we addressed our mental health? Have we addressed autonomic regulation from breathing and all these other factors? Then, if walking is flaring the symptoms at 26 minutes, how do we know it's not visual, vestibular, neck, or autonomic? Well, the only way to kind of do that is to say, let's try, instead of walking, I'm going to get on an exercise bike, because now I've eliminated the bouncing. I've eliminated the visual motion. I'm on a stationary bike. I'm not moving. Do my symptoms still increase at 26 minutes? If they don't, then that kind of points you more in the direction that symptom increase you're experiencing is likely from the other variables, not the autonomic or not the exercise, right? So you really want to isolate those variables to figure it out, right? Because if the symptoms are flaring at 26 minutes due to visual and vestibular issues, then that's fine, right? We want to push into symptoms, visual and vestibular. But if they're flaring due to autonomic, that's not good. So you want to really find out, is it my autonomic system? Or is it the visual and vestibular system? And the way to do that is to isolate the variable during exercise. So say, okay, rather than walking, I'm going to try an exercise bike. Does it still occur? If it still occurs, then that points you more towards the fact that it could be this autonomic issue, which you don't want to push into. You want to find your threshold and work below it, and then challenge the threshold every couple of weeks or so to try and see, has the line moved and does my exercise intensity change now? Does that make sense?
100%. Yes.
Okay. So with the exercise, just taking that idea, I don't care about the 26 minutes. What I want to know is your heart rate while you're doing it. And then if that heart rate, and again, we're looking for a 3-point increase, that's threshold. So if you start at a 3 out of 10 and you do exercise, what you're looking for is, I don't stop until my heart rate, like generally we do this on a treadmill test or a bike test, where we gradually increase your heart rate. Every minute we bump up, we bump up, we bump up, we bump up. And we don't stop the test until you hit that 3-point increase, right? And then what we do is we look at your heart rate. So if you start at a heart rate of, 72, let's call it, average resting heart rate, we get on the treadmill and we bump up your heart rate every minute by increasing the incline of the treadmill to make it a little bit harder, a little bit harder, a little bit harder. And then you tell me at, 130 beats, oh, my symptoms are now a 5. Okay, I don't care, keep going. I bump up the thing again. And then at, let's say 150, you say, okay, yeah, I've hit a 6. Okay, that means your threshold is 150. Stop the test. And now I want you exercising every day below 150. So I want you at 80 to 90% of that. So that means I want you exercising at like 125 to 135, somewhere in that range. You do that for 2 straight weeks for 20 to 30 minutes. And then you come back in, I retest you. Now I can get you up to 170 before your threshold hits that, 3-point increase. Okay, now 170 is your threshold. Now I want you at 80 to 90% of that. And you do that for 2 weeks. Then I retest. When you're doing this on your own, you're generally using the protocol I have in the exercise. Have you hit the exercise module yet?
I signed up last week, I believe, so I haven't gotten there yet. Yeah.
Okay, so you have a lot of work to do before you get to that point. So I'm
Yeah.
explaining all this stuff that's going to come. Don't rush ahead. Like,
Okay.
I don't even want you doing necessarily visual and vestibular and exercise rehab until you've tackled all that foundational stuff. Because if you have autonomic dysregulation and you're doing vestibular rehab, all you're doing is holding yourself back because you haven't addressed the foundation properly, right? If you have inflammation and you're getting neck treatment, it's not going to work well because you have to address that inflammatory thing to get yourself in an optimal position for that stuff to actually work for you. So take everything I said and put that in the future. Right now, focus on like building the foundation, right? Working on calming the nervous system down, working on the inflammation. And when you get to the exercise, you'll be ready for it, right? Because if you're trying to do all this stuff now, all you're doing is too many cooks in the kitchen, too much going on at once, and you can't kind of, systematically address the issues that need to be addressed because you're just flaring yourself up with other things.
Okay.
Does that make
Makes
sense? It's a bit of a slow process and it feels slow at the start because you're like, well, I'm not really doing anything. I'm just doing these little kind of mindfulness activities and whatever else. But that's important because what'll happen is it'll be a slow, and then it starts to really ramp up because you've addressed things properly. So it seems slow at first, but just stick it out because it'll build and it'll start to really exponentially grow and improve once you've kind of addressed that properly. Because if you try to rush through it and try to do everything kind of all at once simultaneously, all you're doing is kind of keeping yourself here, and you'll just confuse your system, and it'll be harder.
Okay. Thank you so much.
You're welcome. So let's skip your second question. We'll move on, and if we have time, we can come back to it. Okay.
For sure. Thank you.
All right.
Hi. Good morning. How are you guys?
Good. How are you?
Good. I have 2 questions about the IGF-1 and also iron. I got my lab work back, and that was one of the things in one of the modules that Dr. Hrkal had suggested getting tested, and the IGF-1 was very high, and I was wondering what, like, out of the reference range, and I'm wondering what that could point to. And then also the iron, just what is normal, what's considered anemic, et cetera. Mine was well, let's, if you could talk about the IGF-1 first
Sure.
and what maybe that means.
Let's start with the IGF-1. So IGF-1 is insulin-like growth factor, and it is a proxy for growth hormone production. What we're looking for primarily is issues with the production of pituitary hormones, which growth hormone is one of them. However, it's most common that it's low. And if IGF-1 is high, that does require some additional investigation to see if there's some sort of, usually it's some sort of extra secretion. So I'm going to use the word tumor, possibly, because that is one possibility. This, when I say tumor, doesn't necessarily mean it's cancerous. If it's producing hormones, that usually means that's not. But it's possible that that can happen. There's other examples of high prolactin, which is another pituitary hormone that can become elevated. So it just requires additional investigation. It's whether that came from a concussion or brain injury or chronic pain is much less common, in my opinion and experience. Usually it's a deficiency of hormones that we see, except for prolactin, because prolactin can be related to inflammation. So it just needs additional investigation.
So like I should get some sort of scan, or like a scan of, like, what kind of scan?
Yeah, so the person that requisitioned the testing should be obviously reviewing this with you, and then they're going to make usually the appropriate referral to either an endocrinologist. That's going to, most often they'll do a CT scan of the brain. They may also do an MRI, because the pituitary is central in the brain, and they're going to determine if that's one of the possibilities. Again, the proper evaluation has multiple steps, but at this point in time, even if this was a patient that I was seeing, this is the perfect example of where you need to bring in a specialist to really understand and help you navigate this.
And that would be an endocrinologist.
Yes.
Okay. Yeah, it was just the naturopathic doctor that had ordered it. And she didn't even bring it up when we went over my results. And I was like, hey, what about the high IGF-1? She was like, oh, that could possibly be indicative of, a dysfunctional pituitary, or it could be a high protein diet. Let's just kind of keep an eye on it. We'll test it again in a few months.
It also depends on how high is it, right? So is it just above range? It is pretty common practice to retest, but there's also, IGF-1, like I said, is a surrogate marker. It's really what we want is to look at growth hormone itself, and that's where there's additional testing that is more specific to growth hormone. And so there's like a glucagon stimulation test, which is kind of considered the gold standard for seeing what growth hormone production is. So it's not you can't just rely on that one value. And those additional tests, they're very specialized. Naturopathic doctors don't do them. This is really something an endocrinologist should be looking at. So talk to your primary care provider, bring up the testing results with them and say, what do you think? And then they should do their due diligence and say, yeah, let's investigate it.
Okay. And then as far as the iron goes, what's considered, what's the range that it really should be in? I think the ferritin was at 19, and one of the others was like 12.1, and I think the cutoff was 12.
Yeah.
So it was just like barely above.
So recently, in the last 2-3 years, I've noticed that the labs that I use, the ranges for iron have changed. So it used to be below 10 or below 5 on some labs, and I think that was woefully inadequate. It was much too low. You can have symptoms of iron deficiency with ferritin levels below 50. So now what I'm seeing on the labs that I use is that anywhere between 30 and 50 is probable iron deficiency, and anything below 30.
And that's for the ferritin?
Yes, I'm talking about ferritin here. Anything below 30 is, most likely iron deficiency. There really isn't anything else that causes low iron. There's many things that cause high ferritin, not iron, because there is an iron test and it's not as accurate. However, if you are borderline, let's say you're in your 30s or anything around even 40, I run a complete iron panel, which includes ferritin, your complete blood count, and then also multiple other markers of iron status. So that's blood iron.
That was run.
Yeah.
I believe the serum iron was run. That was at 96. But the ferritin was at 19 and the hemoglobin was 12.1.
Yeah, you're kind of breaking up there. It was hard to hear, but I think you're talking about your iron, other iron panels. So I did hear that. So it to me, it sounds like you have deficient stores of iron and your ferritin is indicative of that. And so working on repletion is usually you start with oral. There's multiple different types, and then work with your naturopathic doctor on getting that up.
Yeah, so the one question, I started it like just 25 milligrams of like iron glycinate, I think. And I felt like I was floating on nitrous. Like I felt completely out of it. Just very floaty. And is that normal? Like, was it just changing the oxygen flow or?
No, it's pretty common to have digestive disruption and side effects and symptoms using iron. Because it is quite constipating and it can affect your digestive system. But there's also many different types of iron. So you mentioned, I think it was iron gluconate, if I heard you right.
I think it's called bisglycinate.
Yeah, bisglycinate. Okay. So my suggestion, that's generally one of the best tolerated inorganic forms of iron, meaning it's a mineral form. One other possibility is that you can go back to your again prescribing naturopath and look at other options. And the two other ones I would just ask for maybe for them to consider is a heme-based iron. So that's HEME. So I'm going to put that in the chat, heme iron. And that is an actual like animal-based iron. It's generally considered the gold standard for repleting iron, and it is well tolerated. And then there's finally other forms of iron that really have been formulated to be gentle, so much less bloating. I'll put an example of one in the chat after we're done talking.
Okay. Yeah, it wasn't stomach symptoms. It was more in the brain, just as far as like feeling very floaty and out of it and lightheaded.
Oh, I heard bloaty, not you said
no,
floaty?
Floaty. Like I felt like I was on nitrous at the dentist. Yeah, like I felt really out of it shortly after taking it. Does that just cause blood flow changes? Or?
Yeah, in that case, sorry, forget about all I said about digestive issues. That may just be an adjustment issue. Yeah, that is not a common side effect that I've seen, but I suppose it's possible with any drug or supplement that a person has that, and it could actually be something that's temporary. So just kind of stay the course.
Okay.
I'm just while we're on the topic of iron, I'm going to just answer a question from the chat because it just dovetails perfectly with your questions here. The question here was, she has low ferritin at 9. Does this mean I need an infusion? You had some family history of that. So 9 ferritin is quite low, but an infusion is really only warranted when your red blood cells that's found on the complete blood count become very anemic or very low. So you'll see a low hemoglobin, you'll see a low red blood cell count. Now, again, being in the US and you can pay for things where compared to Canada, it's what is approved, then you can go ahead and just get an infusion. Oftentimes, infusions of iron are the fastest way, other than actually getting a transfusion of blood, which is an emergency type of situation. Infusions are the best way to get your levels up. So that is something that you can definitely explore, Janine. However, first order is usually to try oral supplementation and trying multiple different types after retesting. Usually it takes about 6 to 8 weeks for your iron parameters to start changing, and an infusion will be the fastest, but it also is the most invasive. Let's go on to.
All right, so I guess like just a short backstory. So I've been dealing with PCS for about 10 years now. The first year was very hard. I got out of the hole and then was able to kind of build up. And then I spent about 5 years where, I mean, I felt great, but there would just be small, little, tiny things that are non-concussive blows that would flare up my symptoms. And I kind of just learned how to navigate those through exercise, maybe just doing some visual exercises, whatever. And I could normally rebound in a day to a week. And then about 2 years ago, I had just like a golf cart accident kind of, but it wasn't like I didn't hit my head or anything like that. But that basically sent me down to like this, rock bottom. And I built up from there, and like I can get to 100% where I feel completely normal. But now it's like certain things will just like trigger a flare up. For example, riding in a sports car, or even just like just non-concussive blows can cause a flare up. And I'm just curious if that is due to like a PTSD response, or like what I could do to basically get further away from the concussion cliff that you call it, so that way I can stop having this happen. And like I said, like, I mean, I'll feel 100%, and then like yesterday, for instance, I drove a car that has a little bit stiffer suspension just around the block, and that caused a flare up, which like I know I'll be able to recover in like 2 days. Give me 2 days. But I don't know. I'm just trying to figure out what I can do to be able to drive cars like that again. And yeah.
So I was going to show you the concussion cliff, but it sounds like you've already seen it.
Yeah.
So this is like a frequent thing that can happen, right? Like generally these types of flares are just a reflection of incomplete recovery in one or more of those systems. So the question is which one, or which ones? It could be multiple, and we don't know, and there's no way to really know. So how can you stop this from happening? You got to fix all those systems. So if your issue is a PTSD or mental health anxiety response, then that's the area that you want to really be addressing. If it's an autonomic issue like fight flight, which is also related to that, then that's the area you want to address. If it's neck dysfunction and a stability issue, right? Let's say you're turning tighter in this car with stiffer suspension, and you're, driving it a little faster or whatever, and your neck is engaging and you have neck dysfunction, well, that's going to be what flares you up. Or a small little impact, if you have neck dysfunction, that can jar your neck. And if you have some neck stability issues and you're not able to properly stabilize, that could be the issue. So how do you get it to stop? Well, you got to fix all those systems, right? So it's just basically doing all the elements in the concussion fix and making sure that you're doing them fully and in order, step by step, because you have to really build those up, right? If there's any areas in the program, like how far are you in the program?
I've completed it. So I followed everything to like a T for around 6 months, and like the diet and everything. And then about after 6 months, I've kind of let up a little bit on the diet. I'd say I followed about 75%, but still really good. I mean, yeah. So I don't know. I've kind of leaned into certain areas. I've done ART. I get adjustments weekly. I can exercise hard. I mean, I exercise every day, and was talking about like how there's this ramp up, but I don't even really have that. It's like I knew yesterday, I was like, okay, I gotta like try and like, work my way up. So I'm just gonna go around the block. And I almost feel like before even hopping in, there's like a trigger in my brain that's like fight or flight response. And but like before that, I'm feeling fantastic. Like I feel 100%. There's not, and yeah.
Yeah, that was the part I wanted to comment on. The longer that we've been living with PCS, the more ingrained our nervous system is to be hypervigilant to potential threats, right? So it doesn't mean it's a real threat, but your nervous system is responding to the possibility of a threat. So when you're living with PCS or anything else that's chronic, our nervous system starts to live in that fight or flight response. So we're anticipating any potential thing that might happen. And the longer that goes on, the more ingrained it is. So you just said it beautifully for us. You already felt it before you even did the potentially threatening thing.
Yeah. I didn't feel like the symptoms, but like I can almost just feel a switch flip in my brain where it's like, but yeah, so like how do I address that? Because I've tried, like I know that this is not going to cause a concussion. I know that it's not hurting my brain, and I understand that, and I tell myself that.
Yeah, our nervous system doesn't respond to logic, right? Parts of us do, but nervous system doesn't respond to logic. So it kind of goes back to the recovery mindset module where we talk about rebuilding safety. And so before doing something like that, is it possible to do a few of the regulating activities that you learned, whether that's mindful walking or taking some deep breaths or listening to a meditation track? If we can reestablish safety before engaging in a triggering or potentially triggering activity, we're likely to remind our nervous system that we're safe. If we just sort of say, okay, I'm mentally talking to myself, I'm going to do this, it's going to be okay. It's not always effective, right? And the longer things have been chronic, the more important it is to come back to that foundation of safety before engaging in things that could potentially, your nervous system could perceive as threatening. So it might just be, reorganizing your coping skills. So how can you build that in before any activity that you do that could trigger symptoms, so that you're signaling to the nervous system that you're safe, that you're and find that regulation, and then try slow, around the block sounds appropriate, maybe at a lower speed. I'm not sure how fast you're going. But just that sense of rewiring your brain and nervous system to say, I'm safe. Right? And that really is this key part when you've been living with PCS for a long time. For somebody who's very new to the program and maybe it's only been a few months, there's absolutely still signs that they're living in this hypervigilant state. However, it might not be as chronic. So going through the program once might be sufficient. Maybe they built those coping skills. They're able to find that regulation. They're able to find safety in the body and they can move forward. For other people, it's much more complex, particularly if you had any more complex health conditions or life events prior to your injury. So there's just everybody's life is and life events and personal histories are different. And it does impact how you recover. So for yourself, it might be more important, since you've been living with this for 10 years, to find those skills or tools, whatever you want to call them, that can help you feel safe before engaging in some of these activities.
Yeah, and just like to kind of reiterate that is oftentimes like we're redoing the Concussion Fix program. And one thing we found, because when we first put this out there, the program was brand new, so we didn't have the experience that we do now in terms of how certain people figure it out. So oftentimes people get to the end, and now what we're saying is if you've gotten to the end and you're still having some issues, go right back to the start and just literally repeat it, because like you've built yourself up to a point now where most of the time you feel 100%. That's awesome, but these things flare up from time to time. And when they flare up, it just means there's some unresolved kind of issues below the surface. And whether this is an anxiety response or something like that, or that anticipation of it happening that makes your nervous system dysregulate before it even occurs, or whether or not there's maybe some lingering, issues with neck stability or something like that, go back to the start and just be like, I'm just going to repeat this again. I'm going to go through it. I'm going to implement everything 100% again. I'm going to get back on track with it just to build that stuff. Because what you want to do is you're getting to the top of that cliff and you're standing on the edge of it thinking, okay, I'm feeling 100%, but you're still just right on that edge. So you got to kind of keep working on things. And maybe the next time you do it, you pull yourself back, 30 feet from the edge. And then that's helpful. And then maybe you do it again and you pull yourself back to 100 feet away from the edge. And then it just takes more and more to actually throw you off again. So it may be worth going back to the start and just like doing another run, really taking it, slow and doing all the things like you did on the first go, because I think it'll just build again. And then maybe go back to the start, do it again, and it'll build again. And then really what you're doing each time you do it is you're just building more and more resilience in your system. You're just ingraining those practices and doing them better and better and better. So that would be my recommendation for you. Right? Because there's obviously still something going on, right? Is this the anxiety response of it? Is there autonomic? Is there other factors? And it just may take more time because the longer it's been, the harder it is, right? This has been with you for 10 years. So it's really ingrained in you, right? All of these things become really ingrained. So the longer it's been, the harder it is, the longer it takes, but the strategy is still the same. It just might take a little bit more work to kind of, bring you back to, baseline and well away from that cliff.
One of my thoughts here, I know that's been said, excellent feedbacks. Just for you here, the thing that sticks out to me is that whenever you're getting re-triggered, there definitely could be a mental emotional side of things. However, if you are in a car, sports car, that's a combination. It's quite stimulating because you're having these micro movements. If you have a stiffer suspension, really what's being affected is not so much your visual system, but it's your neck proprioceptive system from where I kind of sit. So, the key questions that I'd want to ask, I'm sure Dr. Cam would even ask more poignant questions, is, okay, can any of your manual care providers, because you're saying you're getting treatment all the time, can they recreate any of your symptoms? Is there any way other than you doing some of these things? Because historically, you bumping your head, we know that's not a concussion, but we know that it does affect your neck. And there's a stress response associated with it as well. So is there any other insight that you can give us about your neck and the triggering of those symptoms?
Yeah, no, I like if I go to the chiropractor, they can't get my symptoms out of me. And same with like ART. And yeah, I mean, I truly feel like it is just like my nervous system is so on edge. And yeah, I don't know. I think that's the thing. And
what can you reproduce it by jogging or maybe doing some kind of like HIIT exercises where you're changing posture, riding a bike, like mountain biking, for example?
No, I really can't. It's like if I were to say I was on like a dirt bike, I can like ride it and I've rode dirt bikes my whole life. But if I were to even pop the wheel off the ground, just to do like even just pop a wheelie, when it comes down, the idea of the front wheel hitting the ground, even though it's got really good suspension, it will trigger that same response.
So that sounds like almost psychological, like Cam?
Yeah. The other thing too, can you see my screen where it says neck treatment order?
Yeah.
Right. So the way to think about this is when your symptoms are higher. So this dotted line here is kind of your symptoms, right? Headaches, dizziness, whatever. When your symptoms are higher, you want to start with manual therapy. As those symptoms come down to basically where you're at now you want to increase proprioceptive rehab and stabilization rehab and less on the manual therapy. So it sounds like you've done really good manual therapy and adjustments and all that, but I'm not sure if you're doing proprioceptive rehab or stabilization rehab, because that's what tends to keep things strong so that when you do little things like that, you're able to stabilize properly. Are you doing that?
Yeah. I mean, so like I'll use yesterday's instance, like flare up, for instance. I went and rode on the stationary bike and then I look out the window and I look at, things that are closer and then further away. And I just focus on, like stabilize my vision. Then I'll turn my head and stuff like that. And I think that will help. Like if I just do that for like, it seems like if I integrate that sooner rather than later, I can recover and bounce back quicker. But then like, so I'll be at 100%. So I'll try to remember like, okay, let's focus on, just still working on your vision. So that way you can get further away from this cliff. But it's like, my eyes and everything seem really, like dialed, when I'm feeling 100%. There's not like, I can't really seem to find like this thing is, oh, it's like a little slower or whatever.
Yeah, no. So what you're talking about is like VOR and COR, which is ocular reflex stuff. So if you're looking at a point and you're turning your head side to side slowly, that's cervical ocular reflex. That's different than proprioceptive training. Like proprioceptive training is being able to move your head in space in a very controlled way. So one of these would be have a laser headlamp on and you're looking at a target, you close your eyes, you turn your head, you come back and you try to feel where you are and try to see, am I at neutral? Am I in the bullseye of this target? You open your eyes to check. No, I'm off. Okay, I was a bit high there. So I'm going to put it back in the center. I'm going to close my eyes. I'm going to turn my head again. I'm going to come back. I'm going to try and feel if I'm back to neutral. Because what you're doing is you're training your muscles and joints in your neck to know where your head and neck are in space. That's different than this. This is a different thing completely. The other one is something called a butterfly test, where you have a laser and you trace patterns in a very controlled way to have your neck, head, and eye movement all kind of integrating together. So that's proprioception. Then stabilization is being able to stiffen your neck, right? So it's things like deep neck flexors or holding against lateral flexion, right? You see like the F1 drivers doing like neck, stabilization where somebody pulls and they're trying to stabilize their head on the side to the front and all around, right? The other device that I love the best is the top spin, where it's that football helmet with a rod on it and you actually spin it. And then as it starts spinning, that rod is pulling your head and you have to try and stabilize it kind of like a hula hoop, and it's pulling you all around. And what you're doing is you're increasing the strength and stability of the neck. That's what I'm talking about, is actually starting to strengthen now that the manual therapy has kind of done its work, right? So you've been doing the manual therapy, that's great, but like maybe integrating proprioception, meaning where your head is in space, getting it through ranges of motion with, integrating kind of like certain patterns that you're following with a laser headlamp, or being able to close your eyes and joint reposition error sense to be on target. But then also increasing the stability of the neck by doing kind of stability type strengthening, where you're able to stabilize your neck against resistance. That way, when you go out and drive or do anything, or somebody hits you, you have a stable neck and it doesn't jar, right? Because if your neck is a little bit unstable, doing manual therapy will give you temporary relief from that muscle tension, but ultimately the neck is still not strong, and so any little perturbation is going to throw things off again. So now that things are moving properly, you've done the manual therapy, now it's time to stabilize and strengthen everything around it, so that when you have these little perturbations, driving in a car or whatever, you're able to stabilize. When you come up and you come down, you're able to stabilize because you're able to engage your neck properly. So that's maybe where I'd ramp up now, is on the more stabilization versus the manual therapy, because there's kind of a crossover that needs to happen.
Yeah, that sounds like a really like good clear path forward. And I just want to make sure we highlight that with fear and the anxiety that's there too. There's some really key things that you're sharing with me. The first is that you feel this before you get in the car, and that you're already thinking it has to do with nervous system or like post-traumatic stress. So the two suggestions Dr. Cam just made give you kind of a clear path forward from rehabilitation perspective. But I also want to make sure that we highlight that those things are less likely to be effective if we are feeling any type of anxiety or we are experiencing post-traumatic stress. So I really think Dr. Cam's like 100% on point about how to kind of further any of those instabilities that you have. And then just not to lose sight of also addressing that nervous system and fear piece. that you highlighted already, because if we're feeling the fear and we're feeling a hypervigilant or a heightened nervous system response even before doing some of these things, they're much less likely to be effective or for us to be symptom free when we do go and do these activities, or even the rehabilitation. The research shows us that our rehabilitation efforts are less effective if our psychological coping skills are not effective. So really kind of seeing whether or not that fits for you. And I really like Dr. King's rehabilitation plan for you.
Yeah. Thank you guys. Just last question. So like for the subconscious, like PTSD part of things, like what would be the best way to address that? I tried EMDR for the first time last week, and I mean, didn't help, but obviously maybe I got to do more of it. It was just one session. I don't know. I do cold plunges like every day. I've tried a lot of things for like trying to get my nervous system out of. I think the cold plunges help. Like I would tell anyone who it's definitely worth a try. And I thought it definitely helped, but
Do you get any of those feelings after the cold plunge?
No.
Okay. Yeah. So, everything you're sharing with me, of course, we only get like the smallest snippet in these Q&As. But everything you're sharing with me definitely points more towards anxiety. Now, it's hard to say whether or not it's post-traumatic stress disorder. That's a whole other clinical classification. But we do address this in the program, and we really, really focus on it in the re-record. So once our new program launches, I really encourage you to go back and listen to the recovery mindset module and the nervous system regulation pieces that we'll have in there. And EMDR is a specific type of trauma reprocessing therapy. Have you worked with just a therapist or psychologist that can focus on anxiety and nervous system stabilization or nervous system regulation?
I haven't, no.
Because maybe trauma reprocessing isn't what you need. When you've been living with PCS for 10 years, it's almost 100% certain you're going to have nervous system dysregulation, right? And that's going to be precipitated by anxiety or depression, but it sounds more like anxiety. So working with someone on how to address fears, right? And that bodily response that you get right before you do something, right? So there's something called exposure therapy that can be really helpful. All of these things will really help to align for you to move towards the goals. And I think those goals, like Dr. Kim described to you, are really achievable. But I think this anxiety might be a bit of a barrier. And I'm using anxiety and nervous system dysregulation kind of together because I'm hearing both of those.
Yeah, no, I agree.
Yeah, to me, it seems like you've done a lot of good work, right? Like you've done everything, you've gotten yourself basically to 100%, but it's just these little setbacks, and it seems to be, like Melinda said, precipitated by, the anxiety of certain actions, right? Like riding the dirt bike or riding the car. You kind of have that response before it even happens, probably because you've had experience in these setbacks.
Yeah,
previously.
Yeah.
exactly. I just don't want to deal with it. Like I just
Right, and it becomes a self-fulfilling prophecy almost, like where it's like,
exactly.
right, and it starts to happen more and more. So I agree with Melinda. I think maybe doing some therapy in that realm might be the kind of ticket to get you out of that, right? Because you're not actually doing any damage when this happens. It's the response, right? Like your mind is so powerful, and it's not even intentional, but it just starts to trigger something that then, oh my God, here we go again, kind of thing. And then it's a continuous loop. So we have to do something to break that loop. And that might be the ticket that helps you to kind of move past this thing. But it seems like you're close. Like 10 years, you're almost there, which I think is great. Like I think that's what's amazing, is that you're almost out of this, and you have this one little lingering piece that just causes these little flares from time to time. And it seems like it's precipitated by the fear of flares that almost internalizes
Anticipatory anxiety.
There you go.
Right? It's kind of like, I'm anticipating this to happen because it happened in the past. So I actually feel those symptoms before the event even happens, and it makes me want to avoid the activity.
Yeah.
And that's a protective response. Your body's smart. It's trying to protect you from having that response. But it also can prevent you from doing things that can help you get better. So, the therapy that you could seek doesn't have to be complicated. I would look for somebody who works with anxiety, maybe an exposure therapy type approach, nervous system regulation. At this point, just from what you shared with us, I'm not sure you need trauma therapy or anything to do with PTSD, although it makes sense to have that, that you have a post-traumatic response to things that really flared up your symptoms. But try something a little bit simpler, right? An anxiety type of behavioral therapy that can support you to work through that fear avoidance.
Okay. So should I just, like, the idea of me leaning into trying to just drive the car around the block, should I not even waste my time with that? Or should
I think that's a great exposure. You could just
Yeah.
someone that can help guide you on how to do that. So for somebody who has a very, very high rated fear item, so for example, if anxiety symptoms were like 100%, even thinking about driving a car, this is a different context, then you wouldn't start with that. You would start with visualizing driving the car and working on regulating your nervous system while you're thinking about driving the car. Then you would move on to different types of exposures where you might get in and start the car and visualize driving from there. But you would gradually increase those exposures without flooding your nervous system. Because when you flood your nervous system by just hopping in the car and going around the block, you're already sending your nervous system into a hypervigilant state. So as I was describing, this kind of exposure therapy approach for anxiety or fear avoidance can be really helpful to help guide on how to build that safety in your nervous system in order to do those things without anxiety.
Okay. Yeah. No, I agree. Thank you, guys. I really appreciate it.
You're welcome.
Absolutely.
You're close. You're close.
Thank you.
Keep
Next
going.
Next up is
Okay, so first, thanks to all of you for the program. It's a huge help. It's simply the best resource I found yet. So I messaged Dr. Cam privately about my question yesterday. So it's hard to sum up everything up, but briefly, I'm 13 months into PCS. And now I mostly have left extreme fatigue and strong autonomic symptoms. So I cannot stand or walk more than 5 minutes every 2 days. Being here is also already the biggest load of my day. And I have had 2 short periods where I improved with careful progressive loading, but each time I crashed hard after 1 month. And I'm disciplined, I'm doing everything I can, but I'm still stuck, and I'm starting to wonder if I have shifted into a more chronic fatigue syndrome-like pattern, because it's mostly post-exertional malaise and fatigue that are my main symptom. So I wonder if you have any idea why I'm keeping relapsing, and how would you manage this kind of case, and also if you have seen something such severe.
Maybe I'll start to address kind of the metabolic side of things. So the first thing when someone's experiencing fatigue and they're contemplating if fibromyalgia, for example, could be a diagnosis, that has to be properly assessed and then diagnosed. So have you gone through the channels to assess those particular chronic health issues? Because there's a set of criteria that you have to be assessed with. Usually you start with some sort of internist or rheumatologist. This would be a referral from your family physician, and then of course through that process all the various metabolic issues like deficiencies, iron, hormonal deficiencies, testosterone in men particularly comes to mind. Those should be ruled out. So have you done a lot of that?
Yeah, so I have been hospitalized 2 weeks by a famous neurosurgeon, and they test basically everything they could. And what they found was that I was positive at the tilt table test for POTS, and I also had small fiber neuropathy, but these were just consequences of dysautonomia. Otherwise, I'm clear for everything.
Okay. So when you have POTS, there is a lot of overlap with some of these chronic health issues. So you're looking at, possible mitochondrial dysfunction. You're looking at autonomic dysfunction, of course. Have you gone through some of the treatment associated with POTS? Have you gone through that?
Yeah, so all the recommendation from the Levin protocol doesn't help me much, except for exercise. But exercise, it's mostly detrimental except for these 1 month where it was a huge help and I could build up. But each time I relapse, and for me, exercise is the best thing, but it's also what flares me up. And I also tried, my cardiologist told me to try low dose SSRI, the antidepressant.
SSRI, yes.
But I have felt no effect.
Okay. Cam and Melinda, do you have any thoughts?
Well, I mean, so if you've been diagnosed with POTS, right, even just being upright will increase your symptoms, right? And you mentioned that you're spending a lot of time in bed.
Yeah. So even sitting is quite of a challenge for me.
Right. And so what happens is we tend to spend more time in bed. That actually makes things worse.
Yeah, the deconditioning. I mean, you actually, POTS explains all the things that you're
Yeah.
experiencing. Like it overlaps quite a bit with fatigue, not able to move. Like, I don't think you necessarily, like, to answer your question, Tom, I don't know if we need a further diagnosis other than moderate to severe POTS. If that's what you already have, you're going to have all the symptoms you've described. Adding in another diagnosis like chronic fatigue or fibromyalgia, I don't really know is actually going to be that helpful, because you have an obvious diagnosis with POTS, and there is, that's the area of therapeutics I'd want to focus on.
Yeah, and I think they're just overlapping symptoms, right? The chronic fatigue, POTS, like they have a lot of overlapping symptoms. And then there's also the picture of anxiety and depression that come with POTS, and that has the same symptoms. So, um, like Dr. Paul mentioned, I don't think having another diagnosis is helpful, maybe beyond assessing for mental health, right? I think that may be why the suggestion for an SSRI was there, is that if our mental and emotional state is very poor following a POTS diagnosis, we're less likely to recover because we don't have that motivation, and it's very difficult to get moving and have the motivation to work on the things that can support POTS. So the first line of action might be to address the anxiety, potential depression, other types of mental health challenges that could really keep POTS continuing to be active, because if we don't have a mindset that can support recovery, it can be very challenging to recover from POTS.
Yeah, and it's all interrelated, right? So if you have a really dysregulated nervous system, which POTS is, right? Like it's a really dysregulated nervous system. So your nervous system is not in balance. What that's going to do is that's going to increase anxiety. And then increased anxiety is going to further dysregulate your nervous system. But when your nervous system is dysregulated, that also affects your gut and your bacterial composition and inflammation, which then further dysregulates your nervous system and makes your nervous system more hypersensitive to everything that it touches and pain that you experience. So all of these three kind of components, like mental health, autonomic, inflammation, are all very interrelated. And that also plays into fatigue and all the other things, right? So to me, like a step one for you is like you're saying that you're spending a lot of time in bed. That will further dysregulate your nervous system and make POTS worse. So try to spend as much time upright. You don't have to be standing, but you can start with just sitting upright for most of the time. You're not lying down. You want to be upright, right? Even the recommendation in a lot of the POTS protocols is to raise the head of your bed like 4 inches, like putting stuff underneath the feet of the bed to raise the head up so that you're actually sleeping on an incline so that your body gets used to being upright even while you sleep. And so if you're spending your daytime in bed, that's just going to make things worse and worse and worse and worse and worse. So you want to try and be upright as much as possible throughout the day. You want to make sure you're getting a lot of fluids, a lot of electrolytes. You can even use things like compression stockings when you're upright to try and just increase the amount of return blood flow you're getting.
I did a presentation on all this. Nikki, if you can link it, I looked at dysautonomia and POTS in detail. So, Tom, did you implement all that stuff? You mentioned the Levine protocol. Have you gone down that route?
Yeah, I was there when you did that presentation, and I did all the Levine protocol things, the bed, the stocking, all that stuff. But yeah, except for exercise, it doesn't help.
So it doesn't help. Okay. So in this case, this is where you need somebody to give you some guidance and maybe look at assessment. So you said you went to work with a famous neurologist. Have you worked with somebody that has an expertise in POTS?
Yeah, the cardiologist.
And what are they saying?
He said it's just progressive loading, and he wanted to try this antidepressant, but it didn't help.
Okay. And what about some cardio medications? So there's certain beta blockers. Have you tried? Because it sounds like you've tried one thing, but there's multiple things. With POTS, it's like you have to try 10 things before you might find the one that works for you. Also, with the Levine protocol, it's exercise. So you want to gradually start increasing. If you feel like you have symptoms, you have to decrease the intensity. So are you continuing to try to push that exercise?
So I'm trying to do as much as I can without symptoms, because each time it causes the relapse. And for now, yeah, it's difficult to do more than 5 minutes each 2 days. But yeah, my cardiologist talked about also the beta blockers, so it could be an option to try in the future.
Okay. And then, sorry, one last thing, Cam. In complement to your cardiologist, I don't know where you're located. If you work with a functional medicine provider that has expertise in POTS, they can help guide you in some of the other additional pieces that maybe the cardiologist, because like the reality is that cardiologists, they are very 1 or 2 dimensional with POTS. Try this med, they offered, SSRIs and beta blockers, but after that, they really don't have good insight on exercise. They don't have good insight on adrenal dysfunction. They don't have good insight on nutrition and hydration and the personal guidance for that. And so that's where, you're a perfect example that I think working with one of those functional medicine outside the conventional cardiology box, I think would be really helpful. And that might be hard where you're at, but I would definitely seek that out, because it sounds like you're in a bit of an impasse with what to do.
Okay.
Are you in France?
In Switzerland, yeah.
Switzerland. Okay. Switzerland actually does have a number of different options, because their chiropractic is very strong in Switzerland. Let me see if I can find something to you. Message me on the form, and because I did have somebody else asking about POTS in Switzerland, so I might be able to send you something.
Okay, great. Thanks.
Yeah. And I would just say, like, as a first point, like, I think you do need more follow-up and more kind of, like if the SSRI isn't working, you need to go back and see like what's the next kind of option to try. But just something you can do. It's not, do your 5 minutes or whatever, but just try to be upright as much as possible. Even if you want to be in bed, sure, but just try to sit up. Don't be lying down, because it's just going to make things worse. Like you want to try and kind of almost power through sitting up as much as you possibly can. Try raising the foot of your bed up so that you're sleeping even upright. All of that stuff, just teaching your body that being upright is okay. Because if you're lying down all the time, like even as little as 24 hours of bed rest starts to dysregulate your nervous system. So if we take somebody that has no issues and we put them in bed, within 24 to 48 hours, they'll start to have autonomic issues, because lying down causes those autonomic issues. And because lying down feels better, that's typically what people want to do. And they lie down, and then it just makes it worse and worse and worse. And sitting up becomes even harder and harder. So it's just going to get worse and worse unless you kind of break that cycle and say, I'm going to be upright. I'm going to be sitting upright.
And I've had some success with clients sort of pairing nervous system regulation with then sitting upright. For example, preparing your body to sit upright, because it is uncomfortable and you don't want to do it. So some people want, avoid that because it's just too much. So can you hum? Humming is a real nervous system regulator. So can you hum or gargle water? I have clients who do that, for 5 minutes before they try to sit up in the morning, because it's too much for them psychologically to think about sitting up with POTS, because it just makes them feel terrible. So doing something that can regulate your nervous system before sitting upright, right? Preparing your body for these movements and for things that might be uncomfortable or unpleasant, can be really supportive and helpful. and help you to feel more tolerant of some of the things that you want to work towards. Even something like sitting upright.
Okay, so you would do some parasympathetic activation before any
Yes.
challenge. Okay.
Yep. 5 minutes if you can. I always say 5 minutes because it's a sweet spot. But if you can do more, then do more.
Okay. Thanks.
Is that in the Levine protocol? This activation of your parasympathetic nervous system before doing the exercises? Well enough.
I don't think so.
I don't think it is.
I don't think so.
It's mostly geared around exercise, increased water, and electrolyte intake.
Yeah. Okay.
Yeah, for sure. And
that seems to be the missing link for a lot of people, is this sense of like, but I'm scared. So when I do it, it's not successful because I'm fearful, because I'm worried that things are going to get worse. And then they do get worse because we're vigilant, and that's a negative feedback loop.
Well, and then you don't do the work, and then you're lying down all day, and then it just dysregulates you further, which means that even less activity flares you up, and it's the line's getting so close to you that it's impossible to move forward. So you got to kind of, change things up a bit, and push into things a little bit. Next up is.
Hi, yeah, hey. Can you guys hear me? Okay. Cool. Hi, yeah. So I just started last night. I had an accident a couple months ago, and yeah, thanks for taking my question, by the way. I appreciate you going over time. Okay, mine is kind of simple. So I've been able to fly around quite a bit. My main symptoms are like fatigue and fog, like mental fog and memory stuff. And so I have a wedding in New Zealand next week, but
Yeah.
I'm realizing like maybe the jet lag would be quite bad. And it looks like, oh, according to your protocol, maybe some of the like beautiful Indian food they'll be serving is like not probably good for the diet. I am supposed to go back to work. Like my short-term disability will end in like a month. And so I should probably, I really want to focus on recovery, but I'm also like, is it like screens where like jet lag isn't that bad, or is it pretty bad? And I should just stay at home. I'm just wondering, like, yeah, do you have any tips about that?
Well, where are you in? Are you in North America? Like, what's your?
I'm in the East Coast time zone right now, so it's like a 9-hour difference.
Yeah. So, I mean, it's going to be tough. It's tough for everyone. Concussion or not, jet lag sucks. It'll, you can try to prepare in some ways. Like you can try to gradually get on that time. That'll maybe do something. But traveling itself is also kind of stressful too, right? Like you're trying to make flights, go through security. What did I forget? Do I have everything? Blah, blah, blah. Flying itself, there's no risk. There's, all the evidence shows that it doesn't do anything to impact concussion or concussion recovery at all. So the flying part is not bad, but it's just like, okay, yeah, your sleep might be a bit messed up. Yeah, you might have some inflammatory food, but it's not something that can't be undone, right? So if it's something that you really want to do, a lot of times people will also say they go on a bit of vacation and they start to feel better because they forget about their day-to-day symptoms. They're just able to kind of be in the moment, have fun, experience new things, and they live there, and then they're like, oh, I haven't really had any symptoms, today, and that can sometimes be helpful just to get out of your kind of daily routine. And so I think everyone's different. We don't know how we're going to respond until we do it. If you're really super anxious about it, that can just make it worse because of the anticipatory anxiety that we were talking about earlier. So it's really kind of, up to you. Like I said, can it flare things up? Sure, of course. It makes everyone feel like crap. Like if I was to fly to New Zealand without having a concussion, I would be tired, I would be fatigued, I would be, I would feel like crap because it's just how it works until you acclimatize to it. But when you have a concussion, you start thinking like, oh, I've done something really wrong here. But it's just it's kind of the same stuff. So I would just say, if you want to go, go for it. You've just started the program, so it's not even like you've built this whole routine now that, you can come back and start it when you get back and then really kind of focus on it. So I mean, yeah, and even the symptoms like, fatigue and that type of stuff, that can be related to autonomic, it can be related to anxiety and mental health, and it can be related to inflammation. Those are kind of the three big ones when it comes to fatigue. So yes, jet lag, you're going to be more tired because your sleep's going to get messed up. But if you don't worry about it too much, that'll be helpful. Yeah, I don't know. Anyone else? Melinda, you want to?
Yeah, I just wanted to ask, like, how long do you have from when you return from New Zealand to your return to work? Because returning from a disability, the short-term disability, is a stressor. Traveling is a stressor. So how much time, like, would you have a buffer between the two?
I have about 3 weeks.
Okay.
Yeah. Which does like make me kind of nervous. Yeah, because it has been really hard to work. Yeah.
Yeah, I think having a buffer is important. That was kind of the thing I was thinking about is, you know, if you were to return from this trip and then the following week you're going to return to work, you know, you've added multiple stressors back to back. So you want to give yourself time to recover from a stressful experience before starting a next stressful experience. So 3 weeks is sufficient, right? It'll probably take you a week to recover from the jet lag, and then you've got a couple weeks before you can reintegrate into your work.
Let me ask this. How bad are your symptoms? Like, what's your symptom severity score?
It's only like 54 or something. It wasn't too
That's
bad.
still bad. That's
Okay,
still
it's
not,
bad.
that's not
It's not
great.
like working good, but yeah.
Well, yeah, like, I mean, you know, if you want to get back to work, you want to be a lot lower than that because that's going to be an additional stressor, right? So being lower on that allows you for a bit of a buffer because even if your symptoms kick up a bit, they're still tolerable and you can still work. But if you're at a 54 and you have work in a month, yeah, that might change my opinion on this.
Got it.
Just to say, you know what? Like, what do you really want? Right? I'm sure that getting back to work is a priority, and maybe you skip the wedding in New Zealand because 4 weeks is not a long time, right? Like with this program, the average symptom reduction is 50% in the first 3 weeks.
Gotcha.
Okay, so it does work very well if you follow it and just take your time with it. It does work very well. The average time to full recovery is around 3 to 6 months. That's the average, right? A lot of people in this group have been in there much longer, but a lot of times people are gone after like a month. So you may be one of the lucky ones, right? But even 4 weeks is not a ton of time. And I don't say that to stress you out. I'm just being
No,
realistic.
totally. Yeah, makes sense.
Right? Because you could get on a nice roll and be 50% better, but then you add work back and that just throws you off the cliff again. And here you are because it's another additional stressor, right? So you want to be more comfortable with that. So because you have work in a month and because you just started,
Yeah, it's a tough call, right?
yeah,
Like you don't want to take away something joyful because joyful things in vacation can be so healing. But at the same time, when you have PCS, you want to be mindful of taking on too much, right? Especially if they're all within a short time frame. So a month, as Cam mentioned, is not that long.
Can you miss the wedding even? Like, is that even an option?
Honestly, I probably can. And honestly, I could probably do joyful things here. That's like not a problem. I'm off of work right now. So I could probably like visit New Zealand later. Like, yeah, it's not that big of a deal. It's just like,
Okay. Like if you're not going to lose the money for the flight, or it's not like you're some really close relative or friend.
yes to both of those, but I think those are like overcomable things. I think like mostly this is like the 6th trip I had to cancel because of this concussion, and also because I'm so bad at like anticipating that I can't do trips that it's always like, oh no, I still can't. So but yeah, I think that maybe like if I can't work, I think that's like the worst thing. And I'm starting to get pretty worried about it because I didn't expect it to last this long. So I think that makes sense. This is super helpful. Thanks, guys.
Here's another question. Can you extend that timeline? Because here's what I'm thinking is that if you're already starting to get stressed about it, you haven't really kind of started on this program yet, or like you just joined, right? So like trying to do this work, but also having that thing looming over you will probably impact the success that you're able to have with this program because you're just thinking like, oh shit, now it's 2 weeks, now it's 1 week, now it's next. Can you extend that timeline at all? Like, can you extend it by 6 weeks?
Yeah. I mean, I think it depends. Like, it basically means that I go from short-term disability to long-term disability, and I'm not really sure like what that entails even. I know that they stopped covering insurance, so I think it's just like a little bit more expensive, but I do have like savings. I'm sorry if this is TMI, but like,
No.
yeah, so I think yes, but there's just a lot more uncertainty at that place. So I guess that was like my sort of soft deadline.
Yeah. Okay. Well, here, that's good, because then you can reduce the stress on that. You can say, look, my goal is a month. I'm going to do the work here, right? I'm not going to, don't rush it though. That's the thing. Like, don't try to just consume all this content, because it's not going to help you. Like, just go through it slow and methodically and implement each piece very purposefully, because that it all builds on it. So just don't rush. Trust me. Put your goal at a month, stay there. And if you get to a month and you're not quite there yet, then you have the fallback of the LTD. And then, that gives you a bit more time. So you can kind of lift that weight off yourself a bit. And I think that'll just be helpful, just to have, lifting a weight is always going to be helpful, to just like, okay, I can focus here for a bit and I'm not so strict. Like, I have to do this, otherwise I lose my job or something like that.
Totally.
Kind of like that sense of you can't do it all, right? I think with the 3 things on your plate right now, return to work, New Zealand, the program, one of them probably needs to be put on the back burner or future event, because you can't do all 3 of those at the same time in the span of a month. But it's really hard to make a priority list, especially when, you want to just engage with all of it and return to work and get back to your life. It makes sense.
Totally.
Yeah, I think, Dr. Cam's question about your symptom severity score was really important, because that gives us a little bit of sense of, what that journey could look like for you.
Super helpful. Thank you so, so much.
Good luck, and welcome to the program.
Yeah, welcome.
Yeah, welcome.
Great. I think that's a great spot to wrap it up for this week. I just hope everyone has a fantastic day. Bye, everyone.
Bye-bye.
See you later.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.